Trauma around birth. How 20th century birth practices traumatized 5 generations of babies. This talk, originally given at the 3rd International Psycho-immunology and Psychobiology Research Symposium. My fascination with birth trauma started when I was about 5 years old, when my mother told me that she had had 2 babies before me who died at birth, and that I was actually born 7 weeks early and also nearly died. She told me I was kept in an incubator for 4 weeks and that she didn't see me at all until I was 2 weeks old. She couldn't have possibly known what a gift knowing all this information would be later in my life. I did think it was rather strange that even though I wasn't particularly interested in pregnancy or birth, that I wrote 2 books on the subject. However, when I started to learn more about trauma and complex PTSD, I really started to understand the impact that being born premature has had on my physical and mental health throughout my whole life. And after studying with a psychotherapist called Dr. Naravi Payne in 2006, I started to include questions about birth and childhood experiences in my intake with my trauma clients. While the peak states model considers trauma that includes events at conception and the development through the 9 months of pregnancy, I'm going to look mainly at how historical practices at the time of birth have affected the last 4 to 5 generations. This is the period from roughly 1900 to just around 2000, 2005. We'll look at the ways that we can change the ways we deal with pregnancy and birth to give our children the best possible start in life. First, we need to start by knowing the problem. I found it really interesting to go back through birth practices in the 20th century and see all the ways in which they are significantly negative in their impact on the mother and baby bonding process and baby trauma going forward. In addition to these medical interventions, from the 1960s and 1970s onwards, it became more common for women to return to work after the birth of their baby. For some women, especially in the US, this would be as early as 2 weeks after birth. For others, after 6 weeks, 6 months, or those who were lucky, a year of maternity leave. These days, the mother who stays home with the child or children for 5 years until they start school is very rare. Yet, psychologists have noted that children who are raised in a secure, extended family until the age of 7 are much harder to manipulate. So let's look at the common birth issues that may lead to long-term trauma. This is medical intervention at birth. Long labour, which is in excess of 24 hours. The baby born not breathing and blue. This may be accompanied by cord around the neck. Forceps and ventouse is when mechanical means are used to pull the baby out from the mother because the baby's got stuck. Often due to transverse arrest when the baby's being delivered sideways. Sometimes maybe a breech birth. Preeclampsia is a medical condition which causes very high blood pressure in the mother and protein in the urine and can be fatal to both mother and baby. Placental abruption is when the placenta starts to peel away from the wall of the uterus, cutting the baby's connection to the mother and breaking the source of nutrition and toxic cleaning. Premature birth. Any birth over 37 weeks is considered full term. Premature is pre-37 weeks. Pre-33 weeks is considered significantly early. And in any premature birth, it's the low birth weight that is a concern. So any babies born under 5 pounds are considered at risk and are usually put in an incubator. But the key trauma around the birth period is separation from the mother. And historic birth practices mean this separation has been commonplace for the last 100 years. So there's all different types of trauma in the grandmothers, in the mother, during pregnancy, at birth, and after birth. So the egg that made you was formed in your mother when she was a 4-month-old fetus inside your grandmother. So that egg is as old as your mother is when you're created. And that egg was exposed to the stress experiences from your grandmother's pregnancy and during your mother's whole life. It's common to talk about ACEs, adverse childhood experiences, and slightly less common to talk about ABEs, the adverse birth experiences. But I think that you need to look at both of these to get an accurate picture of the impact of trauma on a particular individual. Some children endure terrible events in childhood, yet seem to deal with them. And it seems that strong, supportive relationships are really important in helping children to be resilient. Some children have a very low ACEs score. They haven't had many adverse childhood experiences, yet they struggle with trauma their whole life. That's because they had adverse birth experiences. Adverse birth experiences prime the nervous system to react more intensely to later trauma, especially when separation from the mother occurs. And early trauma is also the explanation for why two people can have the same traumatic experience, one standing next to the other, when a bomb goes off or there's a car accident. Yet one person will develop PTSD and the other walks away without any long-term impact. So this is because the one who is affected badly will have had early traumatic experiences that prime the nervous system to react. Dr. Nadine Burke-Harris is the Surgeon General of California, and she's considered a great authority on ACEs. She's the author of the seminal book, Toxic Childhood Stress, The Legacy of Early Trauma and How to Heal. However, in the book, she focuses only on remembered childhood trauma and not the pre-verbal events experienced at birth and in the first 2 years of life. I believe that ACEs need to be considered along with ABEs, adverse birth experiences, and even pre-birth experiences to gain an accurate picture of a child's trauma history. At the symposium last year, Dr. McFetridge and I spoke briefly about birth trauma and how it impacts our capacity to have better than normal states of consciousness. His belief is that the simple practice of cutting the cord too soon is the main trauma that blocks our ability to access these better states of consciousness. The medical guidelines as late as 2007 from NICE, the National Institute for Health and Clinical Excellence in the UK, recommend early cord cutting. even though the evidence has been very clear for 200 years that early cutting can be detrimental to the health of the newborn, leading to an increased risk of anemia and jaundice, and in the premature infant an increased risk of intraventricular hemorrhage and respiratory complications. In babies where the cord is only cut after it stops pulsing, they have a higher respiratory rate and a lower relative risk of developing infant respiratory diseases. If the babies are premature, they are less likely to require resuscitation and respiratory support, and may also have less incidence of respiratory distress and sepsis. If the cord is not cut, there is also less risk of jaundice. As early as 1773, that's nearly 250 years ago, authorities were opposing the new tendency to cut the cord immediately after birth. Charles White in 1773 and Erasmus Darwin in 1801. In 1875, Dr. Pierre Boudin measured the blood denied to the newborn. It was about 92 cc's, which is about a quarter of a can of Coke, which, if you consider it compared to the size of a newborn baby, that's quite a lot. In 1938, the therapeutic nature of placental blood was discovered. This blood, rich in stem cells, is now a very valuable ingredient in drugs and cosmetics, but neither the baby nor the mother benefit from its sale to pharmaceutical companies and other hospitals. Fortunately, current medical training suggests that doctors are finally being taught to delay cutting the birth cord until it has stopped pulsing, thus delivering all this blood to the newborn. I spoke to a junior doctor friend recently who described an unexpected birth he had attended the previous week in A&E. When I asked how long he had waited to cut the cord, expecting to be told that he'd cut it straight away, he said he waited 2 hours and was quite clear that this was how he'd been taught at medical school. So it's good to know that these days, decades after obstetricians first suggested there were strong clinical reasons with significant benefit to the baby for delaying cord cutting, that this has finally made it to the front line of birth care in some British hospitals. Key trauma is separation from the mother, and psychologist John Bowlby, who's an expert on attachment, suggested that babies are programmed to connect to their caregivers and recommended that children should receive continuous care from their primary caregiver for at least the first 24 months of life. It's sadly common that children who have breaks in the relationship with their mother at birth, so some separation for days or weeks at birth, or also in the first 2 years of life, this may cause a difficult relationship between them through the rest of their life. I also wonder if the current obsession with fame and attention in the population is due to the lack of mother's attention in early childhood. Studies by John Bowlby in 1973 showed that a separation of only 1 week between mother and child in the first 2 years had a measurable impact on the child's negativity and aggression, and significantly affects the relationship between the mother and the child. This picture shows the Lion incubator from around 1896. There were several doctors who developed incubators around this time. Dr. Pierre Boudin worked hard to publicize the incubators, but it was his student, Martin Cooney, who saw the potential and started taking incubators and premature babies to the industrial fairs that were becoming popular around the world in the early decades of the 20th century. Dr. Boudin wrote the first book on neonatal care, and Dr. Martin Cooney, we're not sure if he was a doctor or not, followed Dr. Boudin's advice to the letter, except for the part where the mother was an important part of the care of the baby. Dr. Cooney used nurses to care for the babies, and while he gave the mothers free tickets to the exhibitions, they were not allowed to handle their children. Disturbingly, he often found it difficult to return to the babies to their mothers once they gained enough weight to be removed from the incubators. Mother and baby bonding goes both ways, and all too often the unwanted babies were returned to the hospital emergency room with broken limbs or otherwise damaged by their caretakers. However, his unorthodox practices saved the lives of more than 6,500 babies, and even in these early days, he had an 85% success rate. After this public exposure, incubators started to catch on in hospitals, and the medical staff adopted Martin Cooney's nurse-centered care, continuing to isolate the baby from the mother. And this method of care continued in hospitals through the 20th century until at least the 1970s and 1980s. This is an image of a hospital nursery in America around about 1960. And the hospital nursery window was still under debate in 2002, when babies were still being separated from their mothers. Certainly for at least 80 years in the 20th century, it was normal for any baby born in a hospital to be separated from its mother for at least the first 2 weeks of life. This was called the lying-in period, and women were routinely separated from their child immediately after birth. The baby would be returned to the mother only for feeding, and feeding was prescribed by the doctors to be either every 2 hours or every 3 hours, and not when the babies were crying with hunger. A fear of infection meant that premature babies were kept away from their parents and family members, with some wards only allowing one 30-minute visit per week. Even as late as the 1970s, such isolation between mother and baby was routine. There was significant drug trauma in pregnancy in the early part of the 20th century, with alcohol poisoning, nicotine poisoning, and pharmaceutical and recreational drug poisoning. Women routinely smoked and drank alcohol during pregnancy until the 1970s, when research clearly showed a link between premature birth and smoking, and physical disability and alcohol. If you think about it, a 3-month-old embryo is 1/5000th the size of an adult. And even at 6 months pregnancy, the baby is still 100th the size of an adult. Medical drugs were routinely used during pregnancy until the disasters of thalidomide in the 1960s and stilbestrol diethol in the 1970s. After this time, the use of pregnant women in any medical trial for any untested new drug was strictly forbidden, and all women of childbearing age were routinely excluded from drug trials. In 1978, the world was amazed by the announcement of in vitro fertilization and the birth of Louise Brown, the first test tube baby. However, reproductive medicine had been working to help couples conceive since the 1950s, when sperm freezing became common, which allowed artificial insemination to develop as a practice to help childless couples. So these are some of the techniques used in reproductive medicine. Frozen sperm, they found it could be thawed and refrozen 3 times without an obvious reduction in fertility. Fertility drugs like Clomid, which meant that women could produce more than 1 egg, more than 1 or 2 eggs on a fertility cycle. And more recent drugs could make women produce as many as 10 or 12 or 20 eggs in 1 cycle. We've talked about IVF, that started in 1978, and now about 250,000 babies a year are born with IVF. IVF led on to frozen embryos. If you create 20 embryos or 20 eggs in a cycle and you fertilize all of them and you implant 3 or 4, what do you do with the other 16 that are still left? So they started to freeze embryos, which meant that mothers could go back and have a frozen embryo implanted at a later point, which was a much easier process than full IVF. And in fact, the oldest frozen embryo was used successfully 24 years after creation. Intracytoplasmic sperm injection, or ICSI, was developed around 1992, and research does show that there's a slight risk of autism or intellectual impairment in this practice. This process involves a doctor selecting a healthy sperm and injecting it directly into the egg. However, a 2020 study by the University of Stockholm and the University of Manchester shows that in the same way that female humans tend to choose the male partners that they want to be the fathers of their children, female eggs also choose the sperm that they want to use. So it's almost like ICSI is a form of rape. And certainly it's physically traumatic to the egg because a needle is stuck into the egg. Pre-implantation genetic diagnosis, PGD, was developed around 1990, and 1 cell is extracted from the developing blastocyst, usually around about the division when there are between 50 and 200 cells. But in the earliest part of the process, when it had just been started, they would take 1 cell out of a morula or a blastocyst of as little as 8 cells. There is definitely a higher risk of genetic malformation in IVF and ICSI babies, and a 6 times risk of genitourinary defects. Neonatal intensive care units were developed in the mid-60s to provide machine and medical care for early babies or very sick babies. Thousands of babies' lives have been saved by these processes, but it doesn't come without a cost. A baby in the intensive care unit may have as many as 6 to 12 painful procedures every day. That's with no anesthetic and no pain relief. Babies were in some hospitals routinely tied down to prevent them tearing out tubes by moving, and for some procedures they were physically held down by medical staff. There was constant daylight in the intensive care, which disrupts circadian rhythms, and the baby was isolated from their mother for weeks until considered healthy enough to be sent home. So how do we do things better? Improved birth practices mean less trauma in our children. So things are definitely improving. Kangaroo Care, or skin-to-skin care, was developed in Bogota in the 1970s in South America. At that time, premature babies were dying at a rate of 70% due to infection, respiratory problems, and simply a lack of attention. I remember a picture in one of my sister's medical textbooks showing rhesus monkey babies clinging to a wire model in the shape of a monkey. Researchers noted that the babies preferred to cling to a wire model that was covered in fur fabric. They found that skin-to-skin contact with the mother didn't, in fact, raise levels of infection. It actually raised levels of survival. In his paper, The Neuroscience of Birth and the Case for Zero Separation, Niels Bergman reported that the human newborn is perfectly wired to exist outside the womb, but its survival is dependent on the presence of the mother and physical cues from her constant and uninterrupted physical presence. In the absence of the mother, it looks like a baby is simply deeply asleep. Yet brain scans now show that the baby is in a state of freeze with high levels of cortisol. Babies alone in a cot had 3 times higher autonomic nervous system activation compared to babies with skin-to-skin care. This is important because higher levels of cortisol in early life activate negative set points that persist through life. Lifetime impacts may be obesity, high blood pressure, cholesterol, diabetes, and a higher risk of diseases like cancer. The tradition of giving a baby a separate room when it's born is another level of routine separation that really needs to stop. Keep a baby in a cot in the parent's bedroom so it's easy for the mother to breastfeed during the night. Dropping one side of the cot and siting the cot right next to the parent's bed means the baby can still hear the breathing of the parents, even though there is no contact. Skin-to-skin contact is better, but many parents are reluctant to sleep with a child in their bed with them. Putting the cot next to the bed combines safety and connection. So how else can we help? Well, one way is education. We need to tell our sisters, our daughters, our nieces, our friends, and our female work colleagues and their partners about how these birth practices cause long-term trauma to their children. We've really lost sight of the importance of the health and the well-being of the parents before we think of conceiving. Not long ago, the practice of getting engaged was purely so there was a period between the engagement and the wedding, which allowed the families of the bride and the families of the groom to make sure that the young people were well fed so that they would be making healthy eggs and healthy sperm to make a healthy baby on the wedding night. Nutrient-dense foods like liver and offal, fish eggs, cod liver, berries and chicken eggs were all put aside from the tribe and given to the young people. Such was the importance of producing healthy children. These days, with lowering fertility, sometimes just giving birth becomes the sole aim, and preparing for that seems to be very difficult for people to do. Another thing that can help to reduce trauma in your babies is to reduce your own trauma. Using practices like emotional freedom technique and EMDR to deal with your own trauma, especially around your own birth experience, is really helpful. And try to live a trauma-free life during your pregnancy. When I was pregnant, I read a book by a Bulgarian spiritual teacher called Omran Michael Ivanov. And he said that a pregnant woman should spend her pregnancy in a garden, surrounded by beautiful things and kept away from stress. Certainly not having to deal with any stressful situations, and going to things like funerals was definitely forbidden. Compare that with the life that most pregnant women have these days when they're continuing at work until the 35 or 36 weeks. Some women staying at work until the day before they give birth. Some higher states of consciousness are inherited. So by resolving your own trauma, you're more likely to achieve these kind of beneficial states, which are a great gift to any child. And some other things to think about. Getting fit during pregnancy. Pregnancy isn't an illness. Pregnant women aren't delicate or fragile, and health is key for mother and baby. And I do wonder if many medical interventions are caused simply because the mother isn't fit enough for birth. It's so important to insist on delaying the clamping and cutting of the cord at least half an hour, at least until the placenta stops pulsing. And note that in Australia, women go the extra mile and don't cut the cord for hours or even days after birth. You can research this online. It's called lotus birth. Another important thing, ideally no separation of mother and baby for at least 3 to 6 months, and ideally skin-to-skin connection with a parent or caregiver all the time. And when it comes to childcare with mother in the family home is the best option. Childcare with another family member at home is second best, continuing until the age of 5. And external nursery care, which is the most common option for most families, is unfortunately the poorest option for the benefit of the baby. Thank you for your attention.